Hey everybody, welcome to Gross Anatomy, where we explore the sights, smells, and sounds of medicine, how it relates to movies, pop culture, books, podcasts, and the world around us. And I am Dr. Jason Cohen.
And I am Lauren Taylor.
What are we doing today, Lauren?
We are dissecting The Pitt Part 2, episodes 8 through 15, the finale.
Wow. You know, before we get into our dissection, I finished The Pitt. It's intense. In order for the podcast, I kind of binged it. I felt exhausted after watching it.
Yes, I told you it was my husband's favorite show, and we always watch it at night, and then I can't sleep well. It is a lot.
It's a lot. Well, they did a good job. Mm-hmm. Here we go. Where are we at? What are we doing?
Well, we can talk about anything else you want to talk about first at the top. You had sent me an article I thought was funny. It was about Sarah Michelle Gellar. Secret to 23 years of marriage to Freddie Prinze Jr. was having separate bathrooms. That's what she said. And that is amazing because I feel like that's probably what I would say.
Yeah, I think that, every guy, I may be wrong, but every guy, is very into their bathroom stuff. So I think there's definitely got to be some wisdom to that. I just thought it was funny. There's got to be something to that.
Yeah, you got to have your separate bathrooms. I think that was a smart thing to say, an honest thing to say.
I definitely think it's a good thing. The only other thing, and we briefly talked about it in our social media a little bit, is Elon Musk. Elon Musk recently made a statement that robotic surgery is going to be, we're no longer going to need humans in maybe like as early as 5 years to do robotic surgery. And I thought that was a fun thing that he said, and it's a good challenge, I think, for sure. And I think, believe it or not, to some degree, there may be some truth to that, because at least with one of the robots that we use, the Intuitive's robot, Da Vinci robot, every surgery theoretically is saved into their system. So there are gazillion surgeries being performed around the world. And if those surgeries are really being saved, if there could be some AI program that could view every one of the gallbladder surgery that's done or the right colon surgery that's done, there are a gazillion of them being done robotically. If it could learn that, then theoretically the robot could certainly help with a lot of the surgeries, and maybe even some of the simple ones, maybe at some point start doing them. I don't think the doctors, the surgeons are going to totally go out of business, because someone's going to need to kind of babysit the robot and make sure glitches are going to always happen, and the belly don't read no book, so there's always going to be some nuance to the anatomy, and so you're always going to need someone who realizes that the belly don't read no book.
Absolutely.
But just an interesting thing.
That is what I have learned from doing this podcast, that there's always things you don't expect. So I wouldn't want a robot just doing my surgery without a surgeon.
Yeah. Thank you for keeping me in business, Lauren. The only other thing that I want to talk about is I don't know what TV show. There's some TV writer that I follow on Instagram who posted this picture of a colon that they removed, toxic megacolon that they removed. And it reminded me of a surgery we recently did, my partner and I, where we removed a huge toxic megacolon that looked like an anaconda, that we posted on our social media and really went viral just this past week. And I mean, that's a Storytime Sunday in itself. This woman, unfortunately, for whatever reason, her colon just stopped working, so much so that over time, and it wasn't like a sudden thing, it was something that took place over a long time, and she was having trouble moving her bowels, or she would only move a little, and over time, because it slowly happened, the colon got more and more and more distended, to the point of finally, when we took her to surgery, it was on the verge of rupturing, which could be fatal. And we took her to the OR, and it was humongous. I mean, to say the least. Check out our social media post on it. And it was so big once we got it out that people were coming in to see what was going on. But it was so big that it was bigger than the table that we put it on after we removed the colon. What happened was, after we removed the colon, it fell off the table, this giant anaconda. It was really that big. It fell off the table onto the ground, and as it hit the ground, it burst. So and no one wanted to deal with it, because it was like, it probably took 4 people. So we had this colon just leaking poop on the floor while we were finishing surgery.
Did you make a new colon? What happened?
What we did was we wound up taking their small intestine and we brought it out to the skin. And temporarily while everything healed, they would poop the intestinal contents would go out to what's called an ostomy or an ileostomy because it's the small intestine. So it would go out to the skin and you'd put a bag there, and that's what that is called. Mm-hmm. And then once everything healed and resolved, the patient still had a little bit of their rectum, which is the very end of the colon left. So once everything resolved, then we'd take the patient back and we could plug the end of the small intestine into that end of the rectum so that they could then go back to having bowel movements.
Well, that goes back to what you were just talking about. This is why you need surgeons. I mean, a robot's not going to know how to deal with this.
The robot definitely could not do that operation. The belly was just so blown up. And there you go. The belly don't read no book.
All right. So listeners can also hear more about this on Storytime Sunday.
They could hear more about it, look at one of our posts, but check out our Storytime Sundays too.
If you want to hear more about these kind of stories like the giant colon, you can follow Gross Anatomy on TikTok or Instagram, and there's a lot of goodies on there.
A lot of goodies.
All right. Are you ready to dissect the pit next?
I'm ready to start dissecting. Let's get going.
We can go to episode 9. Oh, it's just of her finding a spider in a shoe. Like she figures out they think that it's Crohn's disease and she needs all this medicine, and it's Dr. Javadi, and her mom's also a doctor at the hospital. Right. And so her mom comes down and she's like, why are you giving her that drug? And she's like, it's a black widow spider bite. And she's like, doesn't really believe her. Then she turns out to be right.
What do you think of that moment?
I mean, I was just wondering if you've ever treated poisonous bites before, like how she just discovered the 2 little marks were like, would you put that together? That was a spider?
Of course. Yeah. No, I mean, the thing about medical students is that they're taught, they're still students. When we as students take the history from a patient and do the physical exams, we don't leave anything out, or at least you're not supposed to leave anything out. You're really supposed to review all the systems and the heart and the this and the that. Unfortunately, as you become more and more seasoned and more experienced, you tend to just focus on, narrow it down to what you think it is, which is good and it's bad. It'll save time, but you may miss some interesting physical finding that as a medical student, you're more inclined to see because you're still learning. So you're still nervous and you're still checking everything. You're looking in the ears and looking in the eyes. And I can't remember the last time I looked in someone's eyes, for using an otoscope. But when you're a student taking the history and a physical from a patient, you're still doing that, which is funny. Like I remember as a student, it would literally take us sometimes like over an hour to interview a patient and examine the patient and then figure it. And, now you could do it in 5-10 minutes, depending on, your level and what's going on with the patient and how complex it is. Yes, maybe it could happen with a student. It's kind of a cool thing. Certainly, yeah, it's definitely a house moment. I agree. I think the reality is that I doubt that would really happen in real life.
I doubt that the spider would actually still be in the shoe, but that was a cool moment because I have seen those spiders before on my porch in Redondo Beach, and I just figured they were poisonous by the red. And I was right. I never looked it up, but I was like, oh, that could have been me with that stomach pain.
Interesting. Yeah. And it was a cool moment, for the character to all of a sudden, get some confidence and yada, yada, and show her mom that she's ready for prime time. So it was a fun, cute moment. I thought it was cute, but amazing. I want her to work for me. For sure. I want to hire someone like that.
Well, she also, references that like people think that stomach pain sometimes is appendicitis and it's actually like black widow bites.
Yeah.
You've never had that, like where you treated someone for appendicitis and it was something else? Was that?
It's never been a black widow bite. I mean, that's pretty amazing. Like I said, and like we said earlier, and like I love to say, the belly don't read no book. And that's for sure. Oftentimes, and that's the whole point of appendicitis is appendicitis could mask and, it seems like even when it's clear cut, it still could be a zillion other things. And that's why one thing that Pitt always does is Dr. Albee always says to his residents or his students, what's the differential diagnosis? Meaning, what else could it be? He gets everybody to talk about the differential. And that's one thing we learn in medical school and training. You're always, you might think it's the obvious thing, but it's always important to kind of plan, just like life, plan for the worst, but hopefully it'll be the best.
Okay. All right. Oh, there was also another moment in there, which I was curious about when the patient, I think he was like an 18-year-old kid, he took a Xanax or something that wasn't legal and he went brain dead. Remember
Yeah.
that story, that sad storyline?
Yeah.
The parents were there and they finally, agreed to like donate his organs. So one of the nurses is like, or the social worker's like, I want to be out there for the honor walk. And I had
Yeah.
never heard of that. Is that something that?
It must be. I'm not in that world really, but
Mhm.
it must be. They couldn't have come up with it out of the blue. I know there's an honor walk for patients who are cured of cancer, or patients who have been in the hospital for a long time, or like a donor of something. I know they'll do an honor walk kind of thing. Or I know after like COVID, some patients who had been in the hospital for a long time and then finally made it out, they would kind of do like an honor walk thing. So I'm sure it's a thing. I'm sure it's a thing.
So they just kind of decide when to do it. I just thought it was really sweet moment
Yeah.
when everyone comes out there to show the
Yeah.
parents support. But
Yeah.
now that you say that, I did read an article about a kid receiving sickle cell, a new drug, and it took like
Mhm.
3 months of him being in the hospital. But I think he might actually be cured of sickle cell. And I saw there's a photo of everyone like lining up like that
Wow.
as he left the
Amazing.
hospital. So I guess
It's
that was an honor walk. I just didn't know it.
Yeah. I hated that storyline because it just rings so. Yeah, I mean, I think a lot of people today either know someone or know of someone or know someone who knew someone who had that kind of thing happen, and it's just devastating. And as a parent, and it just scares the crap out of me.
Yeah. No, me too. As not a parent,
Don't
it's
I
scary.
mean, aside from the obvious, don't do drugs. But if you are going to do something, make sure you get it from a pharmacy. If you need to take a pain pill, make sure it's your prescription for a pain pill, or make sure it's your Advil that you buy yourself. Don't take anything from anybody. Especially if it's quote a prescription type of drug. Never, never, never.
I agree, and I think it's good that television is reminding people of that. So I
Yeah,
think the did
I
a good
hope.
job with that.
Yeah.
All right, so we're moving on to episode 9. We don't have a clip for this one, but this one did involve a dog, which a dog came in and they decided to let it be an emotional support animal.
Right.
And I was thinking about that, like with so many emotional support animals now on planes that cannot actually be trained to be emotional support animals. Do
Yeah.
you see that in hospitals? Like more animals coming in? Is that something you've encountered?
Well, one thing, interestingly, the whole volunteer department at the hospital, they have a whole pet pooch program, where dogs, are vetted and go and visit patients, and which is amazing, which is a great thing. But yeah, we see dogs, and dogs come to the office sometimes, with their master, with the patients. I still remember years ago, we took care of a celebrity, and after surgery, celebrity had in their bed and never got permission, never got the support dog or anything. But I remember going in to round on the patient, and the patient's laying in bed, with their dog, hugging their dog. And I think that was the first time I had seen it, because I'd been pretty new here, I think, at the time. So it was just so funny. And it was this, tough celebrity with this cute little silly dog, that they were loving, and help the recovery and all that. And it was sweet and cute, and the patient was adorable in general and gracious, but it was just so funny going into the celebs room, kind of, and they were hiding this dog. It was great. I still remember that. Yeah.
Yeah, and you're a dog lover, so I'm sure you don't have a problem with it.
Yeah, but I don't know if you knew that. I am a dog lover, but I mean, that's a whole other story time that I think we've told before. Is growing up, I hated dogs. I hated pets. Have we talked about that?
Yeah.
I hated domesticated animals, but now I've become the weird LA guy, and I love all dogs.
It's cute with the dog, but then it also gets at the very end into something a little bit harsher where our favorite character, the charge nurse, gets punched in the face.
Yeah, yeah. We have that clip?
No, I don't. I didn't think that was important. I mean, she just gets knocked to the ground and that's it.
That was crazy. There's definitely incidences of, especially for ER staff, nurses, doctors, PAs, techs getting assaulted by patients, crazy patients, usually not someone who's not crazy. I mean, that's pretty nuts that someone would do that. but it's not uncommon, someone who's altered or on drugs or delirious or just violent, may strike out or lash out at patients. So you definitely hear those kind of stories. I mean, it wouldn't surprise me if that's truly happened to someone. I mean, I think all of this stuff comes from life to some degree. I've never seen that. I've definitely heard about, patients flailing about, fighting, in general, and wind up accidentally hitting or punching or knocking someone out. But I've never heard of that kind of blatant attack,
Right.
which is.
Well, they say in the next episode, episode 10, which we're going to get into, that, when she comes in, that like basically, Dr. Robbie, what are you going to do about this? Healthcare workers are getting assaulted more and more. Like it's becoming more of a problem. And so your question was going to be if you agree with that, but basically you're saying, yes, it's happening more.
I don't know. I don't know the incidents. I don't know if it's happening more, but it definitely happens. And luckily, again, I'm not really in that world of trauma or down in the emergency room that often. Occasionally I'll be down there to see a consult or whatever. I'm trying to remember if I've been. I mean, I've definitely had patients, been thrashed, but whether or not I've actually gotten truly hit by a patient or anything like that, I don't remember. I don't remember.
Okay.
Yeah.
Well, this next thing I want to talk about, I do have a clip for. It's he's only in this episode, unfortunately, but Dr. Mehta, he's a stroke neurologist that comes in for consults. And so I'm going to play that clip.
Esteemed stroke neurologist.
What do you call a Tyrannosaurus under stress?
What?
Nervous Rex.
Dr. King, meet Dr. Mehta, one of our esteemed stroke neurologists.
How's the patient?
NIH stroke scale of 27, no last known dwell time.
Dr. Mehta, should we take her to EBT?
Not yet. Take first spin in the MRI. Check for irreversible damage first. There's a diffusion flare mismatch. She's still in the window for thrombolytics.
And she still gets EBT. 2-for-1 special.
What type of person is best suited to work with an MRI machine?
A trained technician.
Someone with a magnetic personality.
That one's new.
I just thought that was cute. You don't like him at all?
No, it was cute. It was a cute little comic relief kind of thing because there was not much comedy in this show. But speaking of doctor jokes, it's not really a doctor joke, but I still remember it's a weird story. Actually, it's a great story time that we have to tell one time. And it's so not a doctor joke, but it's just a weird story that it just brought back to my mind. One time I was operating with one of my partners, and I think it was late night, and we're doing some kind of emergency surgery, and we're we're assisting each other across the patient, and this part of mine keeps like backing up and going, ah, and then he'll work for a little bit and I'll keep, ow, and I'll keep doing that. And eventually he looked down to see, and for whatever reason, he didn't realize he left a suture driver with a suture in it out, exposed. And he kept banging into this needle, I think in his crotch, I think. And finally he realized, I don't want to know what his penis looked like, but it wouldn't surprise me if he had a bunch of little pinpricks on his penis after that case. And that was funny. And I remember the nurses like cracking up that, that happened. There's definitely laughter in the OR. Yeah, for sure. And actually I talked to a patient today who's a rabbi, and the rabbi said, while things that I do might be serious and events and might be serious, I never take myself too serious, or is it seriously? And I think that's a good way to live. Never take oneself too serious or seriously. I have no idea.
Well, apparently Dr. Mehta in the show she says if a joke makes someone feel better, he's all for it. Yeah.
Laughter and amusement and joy definitely helps, and it's all about mind over matter.
Yep. So that was Dr. Mehta. Then in episode 10, it gets a little more serious. Dr. Langdon, it turns out he is stealing drugs.
Yeah.
I don't really get how. Is he like opening the vials? Did you understand that?
I didn't understand. It seemed like maybe he was opening the vials and then gluing them back, but then he would also steal the pills from patients too. That was easier, I guess. But yeah, it seemed like that's why she was saying, oh, it's hard to open this. Maybe he would glue it back with crazy glue or something like that.
Yeah, I guess that's maybe supposed to make us like that doctor more too, because she was right.
I hated her. Still hated her.
So Dr. Langdon's out, and I guess what I mean, I guess you probably couldn't even say if you had that problem before with another doctor, but I mean, what is the protocol? You just have to report it right away, I guess. Or I mean, Dr. Robbie's
Yeah,
going to save lives, so he didn't have time.
yeah. I don't know. I don't totally know the protocol. I don't know if, exploding at someone, especially who's supposedly your friend,
Yeah,
uh,
that has
is
a drug
is
problem.
yeah, is the right thing to do. Usually, it goes to like the board, the hospital board. The hospital has a medical executive committee usually, but usually, my guess is they do act pretty fast.
Hmm.
Um, I mean, obviously, it's fictionalized and accelerated to make it dramatic. I think if he were his real friend, he probably might, in a real life situation, it probably would have been different. But you never know. You never know how people under stress react.
That's true. Dr. Robbie was under a lot of stress, but I didn't think about that because it seemed real in the moment. But now that you're saying that, that's definitely not how he should have approached that at all as his
No,
friend.
no, like one of his best friends. So that was kind of weird. And then as a mentor and everything, you would think too. But that his day of being there, it's a traumatic day, and he's under a ton of stress. So maybe that's why he reacted. But I think in a normal situation, the person would be differently and would maybe even have other people there potentially. I'm not totally sure. But it happens, unfortunately. And in fact, crazy story. It just reminded me. There was I think she was a radiology X-ray technician when I was at Kings County Hospital in Brooklyn, and it was and this was a zillion years ago. It was, this was at least 26, 27 years ago, maybe more. And I was a resident there, and I knew who she was, but I didn't really know her. But I definitely knew who she was, and she was an X-ray tech. She was very friendly. And one day in the morning, I think someone opened up one of the closets in the operating room. There was some closet there in the hallway, and out fell this girl, young woman, dead. She had injected herself with something, overdosed, and died. And they found her, and it was, everybody heard about it. Everybody knew who she was. And while I definitely had talked to her, I definitely knew who she was, and it was just crazy. But back then, drugs were so much easier to get and take. These days, it's so much harder. It's so locked up, counted. So you really have to, for you today to get drugs like that, you really have to kind of be super sneaky and have a plan and figure it out. But back then it was way easier. I have a lot of other stories. Actually, that could be a whole other episode, I think,
Okay.
about people I know, a friend of mine who had a problem. Yeah, we should definitely talk about that a little bit.
Okay. Yeah, no, I would like to get into that more. But like you said, it's harder these days. So maybe that was the point of like the bottles, how he would get so sneaky with it.
Right.
Exactly.
For
some reason, the R1 figured it out. Maybe she had seen something like that before.
Yeah, I think she just had it out for him, and so was deliberately looking and found it.
Right, that's true. All right, well, that was that episode. So then it gets a little bit more serious going into episode 11.
No, you mean it's continue? What do you mean it gets a little more serious? The whole thing is serious. The only levity is that one silly neurologist.
I know, that's why I wanted to.
And the rat that he catches, that the kid catches.
I should have shown the dog with the rat. You're right. We should have shown that clip, but I went with Dr. Mehta because I don't know why I like the doctor jokes. I like dad jokes or whatever you call them.
Yes.
So it's very serious. So episode 11, this is where I kind of have a problem with shows. Like they just throw everything in there. Like, you do abortion, you do drugs, you hit all of these big beats, but
you got to
think they were going to go this far. They went to a mass shooting too. So I didn't know we were going to have that. So episode 11, the charge nurse, Dana, takes a call and she says it's a code triage, multiple GSWs, which I know means gunshot wounds. There's an active shooter at Pitt Fest.
Yeah.
And so that made me think of, it's like code triage. Like what kind of codes did you hear like at the ER, like them calling? Like,
back in my day when I was doing trauma and emergency and working in the emergency room, we weren't so fancy. I don't remember. It was years later that they came up with all these codes and colors.
Yeah, I figured that. I was like, yeah, because I had to like actually rewind it to like figure out what she was saying. But I think it was triage.
It's a whole generational thing of trying to say more, convey more by saying less. It's all the abbreviations and all the, everything, and type LOL, all that stuff. That none of that was when I was coming up. All that stuff's new. All
it
the
almost
codes.
doesn't seem helpful because it's like just something else you have to remember. But
yeah, I think anything was just a code, and that's it. They just called it code.
Okay.
And then they gave it colors. There are there are a lot of different colors. There's something for fire. There's something for child abduction. There's something, and each one is a different color or whatever, which is interesting.
What do you mean?
Where I am. What?
What do you mean? Explain it. What's a different color?
I think code pink at the hospital, at least where I am, means child's been abducted.
Oh.
So they'll go code pink over the loud, code pink. Whereas I think code red is fire. I'm not sure. One of the codes, some things means it's a fire. Another code means it's an abduction, or none of the, like a altercation and a physical thing. And they're all meant to, so that regular people don't know what the code means. It's just some kind of code. And you have to, check your codes book to see what it means.
You think maybe everyone would want to know there was a fire. Yeah.
Yeah, exactly. Yeah, no, so there's a different thing for each code.
Okay.
Yeah.
Yeah, that was going to be my question. How do you know all the codes? Okay. So this is
nobody knows.
Nobody knows.
But I think maybe in the back of people's, how people have badge buddies on the back of their IDs? I think you're supposed to have all that. All the mandatory information is supposed to be on the back of your badge or in your badge, so that you're, okay, I'll check my badge and see what the code is.
Got it. Well, after that, they locked down the hospital.
And then there's a code brown. At least in the OR, you know what a code brown is? Guess. What do you think a code brown means when the nurses are in the OR and they'll be
diarrhea explosion?
Yeah. Patient poops on the table and they have to clean it up. That's a code brown. And, all of a sudden you're operating and it reeks of poop and you're like, oh man, it's yeah. I don't know if that's a hospital-wide thing, but it's definitely something that you say in the OR, which is code brown. Yeah, for sure.
Got it. All right. Well, all right. So they locked down the hospital, set up a command center. The administrator says the night shift is about to come, but they will need more help, and that a group text went out to everyone for more help. So my question to you is, have you ever received a text for group help, maybe when COVID was going on as a surgeon or anything like that?
Luckily, I haven't. But the only thing, and I've told this story, my 9/11 story, I think. I was a brand new fellow at the hospital it was 01, right? 9/11 was 01. And I was pretty new. And I was still asleep. We were in LA. And all of a sudden I get this phone call. I still had a landline back then. I get a phone call and they're like, okay, Dr. Cohen, we want to make sure you're ready and everyone's ready. And And I'm like, who are you looking for? I'm a fellow. I'm like a pisher. I just come to the hospital. They're like, Dr. Cohen, right? I'm like, yeah. Okay, we want to make sure everyone's ready and yada, yada. And I'm like, what Dr. Cohen are you looking, who are you looking for? They're like, J. Lewis Cohen, right? And I'm like, no, this is Jason S. Cohen. They're like, oh, okay, bye. And I'm like, wait, what's going on? They're like, turn on the TV, and they hang up. And then I turn on the TV and I saw the towers. And then we all rushed to the hospital. Everybody, I think, rushed to the hospital. And then it turned out they shut everything down at the hospital where we were thinking that something was going to happen in LA, and they kind of just all kept us on standby. And I remember across the street from the hospital was Jerry's Deli, which isn't there anymore. And I remember just sitting there with one of my buddies, also a surgeon. We kind of just sat there all day in disbelief because we're both from New York, just kind of sitting there, kind of seeing if they were going to need us, and also just freaking out. And but even for that, I don't even think there was kind of everybody communicated, but back then phones weren't. I mean, this was 24 years ago.
That's interesting. So they could have used text messaging, a mass text message. They were literally just calling everyone.
Yeah, exactly. But other than that, I've never gotten anything like that. Interestingly, we do get these alerts and alarms that by email, or when we open up the electronic medical record, that the hospital is full to capacity to try to discharge your patient. We get a lot of those messages. Hospitals at capacity, try to, because there's just like in the pit, there's a ton of patients in the ER trying to get upstairs, trying to get seen. So we constantly get these alerts. Try to really discharge your patients. If they don't need to be in the hospital, get them out. So those everybody gets all the time.
Okay, I see. All right, I was wondering about the text messaging for mass casualty situation. I guess you haven't had to deal with that, so that's amazing.
Luckily, no.
Yes.
Luckily, no.
Well, so that's episode 12, and then episode 13. Obviously, this keeps going because they have the hospital in lockdown, so it's all these gunshot wounds. There's blood everywhere. You've seen the whole thing now. I'm not spoiling it for you, but there's so many gunshot wounds, and they don't have enough blood that there's a lack of O-neg blood, and Dr. Mel decides to do something crazy, which we have a clip for.
Her pulse is weak and thready. She's bleeding out from her liver lag. I need O-neg.
O-neg's gone, honey. Glory's got more flying in. Incident command. What's the ETA on our blood? Patient's gonna have to get by with a liter of saline.
No, she needs blood, not crystalloid. Can she go to surgery?
All right, she's next to go. As soon as we get it up in OR.
She's not gonna last that long. Dr. Robbie. Dr. Robbie? Dr. Robbie, we're out of O-neg, but I'm O-neg. Can I donate?
Glory's got more blood flying in.
But I need it now.
What is our blood status?
Just use the last units of O-neg and O-pos more flying in.
ETA?
Less than 10?
Some patients are not gonna last that long, and I'm sure there are other O-neg donors that probably work
It
here.
would take hours to screen for HIV and hepatitis.
Well, I have neither, and I donate all the time.
Please.
Fuck it. If the patient's gonna die before they get to the OR, then the benefits outweigh the risks.
My man. All right, kid, roll up your sleeve. I'll meet you in 7. Listen up. Central 789 is now the blood donor center. Anyone who's O-neg or O-pos, we need you to donate now. Hands where I can see them. Okay, let's do this.
Okay, I'm done. Can you come back? Come on.
There you go, there you go. Next!
How's she doing?
Yeah, 500 of saline in, just barely with us now.
Okay, well, this unit of whole blood should help.
Yeah, see if you can find a pressure bag.
No, much faster if I just squeeze it in myself.
Okay, I really wanted to know your thoughts on, like, more than anything, the makeshift blood bank, because it seemed very questionable.
I don't know. It was great. I and really amazing ingenuity. And my guess is somewhere, some place that must have happened.
You think so? Maybe.
I don't think it's all, I mean, it's a fictionalized show, but I think a lot of times they get a lot of the stuff from someone telling some story. So maybe in a battle or in the hospital, in a military hospital, or who knows what. So my guess is, I don't know. My guess is I have no clue, but it was good TV.
Well, they do have that one doctor referencing, like, when he was obviously in the military or something, what they had to do. So maybe that's true.
Yeah. It's possible. Who knows? In wartime, anything. And that's what he said, the benefit outweighs the risk. So it was cool. It was cute. I don't know. It was good TV as far as I'm concerned. I don't know. I haven't heard of it happening, but definitely, there's doctors and nurses and staff give blood all the time. When we find out there's low reserves, I don't know about an emergency, but it's definitely a common occurrence.
Oh, I didn't know that. You guys do donate all the time? Of course you do.
Yeah.
Nice.
Yeah.
Okay. All right.
Although I have to confess, should I make a confession? I don't. I can't. I don't know if we've told the story. I can't.
We have.
I can't have a needle stuck in me. I pass out. So if I had to give that much blood, plus I'm anemic, by the way. But when I have labs drawn, I have to lay down. They all know me. They think I'm ridiculous. I have to lay down to have even just a little bit of blood drawn because I'm pathetic. So I don't think I could give blood. I don't know.
Well, my father told me I can't donate anymore because I tried twice because I felt guilty like I should. Pass out twice. Just can't.
So we're of the same. We're cut of the same pathetic cloth, you and I. I
tried to be
apologize.
helpful, and I ended up making it more of a mess.
Yeah, I'm sorry, everybody. I'm pathetic.
We tried. We passed out. I don't know.
Yep.
It's weird. All right. Also in this episode, Dr. Robbie tries to save his ex-stepson's girlfriend. Has a breakdown. Wow. Yeah, it's a lot.
Wow. Do we have a clip of that or no?
No, there's not a clip of his breakdown. We remember it, and I definitely think it's going to win him an Emmy. Just that scene.
He's definitely getting an Emmy. He's definitely getting an Emmy.
Better.
He's great.
He's great. So he has that breakdown, but I feel like it only lasts like a few minutes. There's like the R1 that comes in, tells him basically to get back out there or whatever he does, but he gets back out there.
Yeah. The interesting thing is during that breakdown, he starts saying a prayer, right? And they talk about it for a minute. And when he's in the room there, he starts praying. And the prayer he's doing is a Jewish prayer because his character is the only Jew in the entire TV show. And he starts saying Shema, which is basically has a passage of the Bible in it about, and often it's something we say first thing in the morning before we go to bed. And also theoretically at the time of death, if it's kind of like the Jewish equivalent of last rites a little bit. And he was saying the Shema. And I think it was just his way of kind of trying to connect to faith, which I think is what keeps a lot of people going. I did like that moment that they did that and give a kind of a shout out to the Jewish faith.
Yeah, that was a nice moment. I mean, it seemed to comfort him and help him.
Yeah.
And he gets back out there and keeps saving more lives. But I mean, our one, I forget that doctor's name, but he tries to comfort him in whatever way he can. But like during COVID and everything that you've seen, have you ever had to like comfort a doctor or seen a doctor that's had to like take care of someone he knew and then like have a breakdown? I mean, I know you're not supposed to treat people, right? Like you can't treat your family.
Yeah.
Or is that a different podcast altogether?
I mean, theoretically, you're not supposed to treat immediate family. That's not to say, if you're the best person out there and you got to treat your family if there's no one better.
Yeah. And you can. I mean, there are surgeons that do.
Yeah. I mean, there's no rule that you can't. It's just like an unspoken rule that you shouldn't, I don't even know if it's like it may be hospital policy that you can't treat an immediate family member. But I've heard, I've taken care of distant family and close friends because I thought that I was probably the best person to do it, or I would get someone who I thought was the best person and I would be there assisting, really making sure everything went amazing.
Right.
Which I think is fine. Yeah, I've taken care of, one of the nice things about being here for so long, I've taken care of a lot of doctors, a lot of, friends who are doctors that I work with or doctors who aren't friends and that I've just known through the community. And then I remember there was one doctor, a pretty well-known, well-liked, well-respected doctor who was sick in the intensive care unit for months, who everyone thought was going to die of COVID. And amazingly, miraculously, he made a full recovery. Everybody knew the guy. Everybody loved the guy. And luckily, he recovered. But for a long time, everybody was saying how it was touch and go for a while. Yeah. Pretty amazing.
Yeah, and then Dr. Robbie has the opposite, but he's dealing with that trauma from his mentor dying of COVID after, I don't know how long he was in the hospital for. It doesn't say, but yeah. It's a lot. So yeah, they're dealing with the mass casualties, the blood, and then Dr.
I did think, Lauren, the show did a nice job of talking about mentioning COVID, and not ignoring COVID. And I thought it was a good takeoff. The whole show started post-COVID. Here's the world post-COVID. But I kind of liked how it acknowledged it, talked about it. I thought that was cool. I thought that was interesting.
I did too, without having to put us like through too much of it again. Like just like right. Exactly how it did it was perfect. I agree.
Yeah. I thought it really did a good job.
Yes.
Interestingly, did you and I, or it was pre your coming back, we talked about that Dr. Odyssey. Did you and I do that episode?
No, you had seen it before I came back because I had asked you if you wanted to watch it. Yeah.
It was terrible. I mean, it was silly. It was like The Love Boat, but even sillier. But that character also had a post-COVID, also almost died from COVID. So it's an interesting theme. All these shows are kind of launching off of COVID, which is just interesting.
I did not know that, but I thought that show was a hit because it was always like in the top 10 of some streaming service I watched.
Was it really?
But apparently not, because they just canceled it. I read that it's not coming back for season 2.
I'm surprised it even made it to air.
Oh, really?
I mean, it was fun. The actors were fun. They were good Don Johnson, I think, was in it. And Josh, the guy who plays...
Joshua Jackson, I think.
Yes, exactly. Yeah. So good fun actors. But it was a soap opera, like a silly...
Yeah, the trailer looked ridiculous. But I was like, I guess this is what people like. But, I guess not enough. They canceled.
The fact that they made a whole season of it was remarkable.
Now I kind of want to watch it just a little bit.
You should watch the first one, and then let me know.
So Dr. Robbie gets back out there. He's dealing with all of this in episode 14. And then he goes into a room where other doctors are arguing, and I have a clip of it because I just want to see how you would handle this.
As usual, thank God. Guide wire and introducer.
What the hell are you doing?
Dr. Mohan is about to pull air from the right atrium and right ventricle.
With what?
By French pigtail catheter.
Inside his heart.
Multiple side holes gives you a better shot at sucking out all the air.
Dr. Abbott showed me a case report from South Korea.
What the actual fuck? I just talked to cardiology. They want a CT scan. If it's showing air, then you need to dive him in the hyperbaric chamber.
He'll be dead by then.
Not if you kill him first with this banana pants
We don't
procedure.
have time to wait for your fancy pants machine. You don't get the air out of his heart, he'll die.
This is not the standard of care.
Fuck standard of care. We want to save him. We go in now.
Maybe I should.
Thread in the pigtail. Excellent idea, Dr. Mohan. Go down to 24 centimeters, and then we'll confirm with X-ray. Good.
Think I'll stick around in case you need another set of hands to resuscitate your patient when he crashes.
Pigtails in the right atrium. Good position. Aspirate. See what you get.
Pulling back blood from the heart. Along with some air.
How about that?
BP still only 85 systolic.
No improvement.
Advance slowly into the right ventricle.
How do I know when I'm
PVC. That's how you know. Aspirate again.
Run a 3,
more blood and air coming out?
run a 5.
Non-sustained VTAC, charge to 200 for when he deteriorates.
May need blood now.
Pull the pigtail back to the RA. Pull the pigtail, Dr. Mohan.
Step aside.
You got this.
Normal sinus rhythm, 92. Pulse ox is improving. BP is 112 over 84.
Not too shabby, huh, Dr. Walsh? I think we can admit him to general surgery now.
Hell no.
He's a gunshot victim.
Admit him to the cardiac ICU. We'll consult from there.
Or you can admit him yourself with cardiology consulting. I thought you liked flying the plane.
Not when it's gonna crash.
Does that seem real to you?
Solid work.
That was fun. I like that one.
But that made me think, like, obviously this mass casualty situation is a little bit different, but like there must be surgeons that you've seen arguing when an R1 was like trying to figure out who to listen to, or has it ever happened? Like how would Dr. Mohan know who to even listen to? I mean, I guess she chooses right, but it's like, what would she do?
That kind of stuff definitely happens, but I have a few thoughts. This show managed to, any single procedure that's cool, this show did in one season. Like there are no more cool procedures left. They did all these cool procedures. The other thing was, I thought it was very reasonable what he was doing, believe it or not. I didn't think it was that crazy, but it made a lot of sense. But she is an emergency medicine resident, and he's the emergency medicine attending. The other woman is a surgeon. So it's chain of command. She goes to her boss. She's in the emergency medicine department. So it's right that she listened to her guy as opposed to her.
Oh.
She listened to the person that she reports to. Even if he were wrong, she probably would have listened to him because that's who she reports to. That's her chain of command. It's a different team. That the surgeon's on a different team. What I found fun and accurate was after they saved the patient, just a little nuance of who has to admit the patient, which is a very real thing that happens when patients get admitted. There's always like, who wants to be, because if you're the admitting team, then you're in charge of everything. You get all the phone calls. You have to deal with everything regarding that patient. If you're just the consultant, then you don't have to deal with all the minutia. You could just talk about the specific thing that you're there for. So I thought that was a fun, and most people didn't even appreciate that. Probably only the people in healthcare.
I didn't until you just said it. I kind of thought it was all a little hyped, but yeah, you're making.
No, that's such a real thing. And the fact that they threw that in there was interesting that they bothered to do it because that's so real. Like I never want to be the admitting doctor, whereas some of my partners do. And I think they want to do it to show that their census is high. I have all these patients that are mine. And mine, which is fine, I guess, but they want to kind of show off. But in my mind, it's like, I'd rather let the medical doctor take care of, I got a headache. Okay, call the medical doctor. Oh, my blood pressure's high. I don't want to be the person, I hate to say it, I don't want to be the person getting called for that. I want to get called for the thyroid issue only, the surgery that I did, or if I did some kind of laparoscopic or robotic surgery. I just want to be called about that. I don't want to be called, oh, the patient's, has a sore throat and needs a lozenge. Call the admitting team for that. So that's always a fun turf war about who gets a patient, especially someone that's already had the fun part done. Then who has to, quote, I hate to say it, who gets to babysit the patient, while they're recovering.
So obviously they have really good medical consultants that they're getting these like minutia things that I didn't get until you just explained it.
Yeah, those are fun pearls for the medical people.
Thanks, Dr. Cohen. A little insight. All right, so we're getting to the end of it. Then, of course, like as I was saying before, they throw everything into these 15 episodes. They have a patient with measles come in because, of course, they do when they're supposed to be like locked down, or I guess they're just opening up this. They have nowhere to take this kid. So, of course, he comes in. He hasn't been vaccinated. And then his younger sister says that she traveled to a dance competition with the measles. And I guess she recovered on her own. But the parents never reported it to the CDC. Like, I thought that was a requirement. You don't have to like say when your kid has the measles that you don't take them to the hospital. That's just fine.
I don't know. That's kind of where the show decided to go a little political, and I don't think it needed to do that. That was like, let's throw in some politics,
Or just the measles. Yeah, I was like, you just had a gunshot. Like you just had all these gunshot victims. Yeah. Now we're getting into the measles. Yeah, I thought it was a bit much too. So
I
don't even know what to say.
That was one of my least favorite parts of the show.
Yeah. All right. So we don't even need to watch a video about
going political because that's political. The only reason they put that in. Well, whatever. I don't know.
Yeah, we don't even have to talk about it. All right. So episode 15, the end episode. That's all the clips we really have for today. What did you like the ending? Do you like how it wound down? It was like they were just literally still like going over blood spots in the hospital, and like the night team was coming in and they were finally going to leave.
Yeah. The crazy thing is they stayed in their bloody gowns too long. They didn't change. That I thought was weird. That kind of bothered me. They probably normally would have changed gowns a little bit. The other interesting thing is, in medical shows is you want to see everybody's face. That's where the acting happens. So nobody had masks on, if you notice, all these sterile procedures, these major sterile procedures. If we're doing them in real life, we're wearing masks. So that's kind of funny, especially in the days of COVID, wear a mask. No one had a mask on. So, but that's TV, but it's kind of funny, watching that. Like, and not only that, the girl, the resident, we looked at the clip where they're, after doing the thing with the air embolism, sucking the air out of the heart, her hair's everywhere,
Yeah.
That would never happen.
Yeah. There's a lot of problems, but I did notice that, like before the gunshot victims, that Dr. Robbie was sanitizing his hands a lot. I guess that was from COVID, but you're right. He wasn't wearing a mask. So it doesn't make sense because that's not.
Yeah. There should have been there should be a disclaimer at every episode saying, in the beginning, normally we would all be wearing masks, something like that. No, please imagine everyone is in a mask.
If your surgeon is not operating on you with a mask, something's wrong.
Yeah. Or your ER doctor too, if they're doing some major, if they're sticking things into their heart,
Mm-hmm.
No mask.
I didn't even see. This is why I have to ask a doctor about all these medical TV shows.
Yeah.
I kind of missed that.
Yeah, I kind of liked how it ended. Did you?
I mean, it ended with them doing what they do at every night shift. I guess just figuring out a way to deal with all this trauma that they've seen, and they drink some beer on a park bench.
Yeah, and that was interesting. And what about the part where he takes his leg off?
Yeah, because he had seen combat.
Yeah, I thought that was kind of cool. Like he was, I like that guy. I didn't initially like him so much, but in that final, and during the mass casualty thing, I really started to like that guy. He was a good character.
Yeah, I should have looked him up before we talked about this, but I know I've seen him in something else before. I knew he was a good actor. I just don't know what I know him from.
Yeah. I don't remember him, but it was cute. I thought they wrapped it up nice. I have great ideas. I'm waiting for them to call me for season 2. I have some phenomenal ideas for direction for them to go. And I've talked to, I think it's approved for a second season. I'm not sure if they started writing it yet. So I'm ready. I I know you guys have been trying to reach me. I'll try to make myself available, but I really do have some cool ideas for a second season of how they should go.
Yeah, I mean, I don't know how the creator's doing it, but I imagine as it was airing, he's coming up with some other storylines, assuming it was going to get picked up. But we'll
Who knows?
see how long it takes. Hopefully it doesn't take 2 years like most TV shows take to come back.
Exactly. Or longer.
I know.
So is your husband's favorite show?
He really likes it.
Wow. What about you?
My favorite show of the year so far.
No, I mean, did you love it? Scale of 1 to 10.
I'd probably give it an 8. I mean, it's a good show, but
yeah.
did I think like, yeah, when they put so much in, like, okay, now we're gonna do the measles, or like now we hit everything, or like,
yeah.
I don't know. And maybe you're right. Like maybe they really do talk to real people and they see all these things all day. I don't know.
Yeah, I agree. I think it was a solid 8, maybe even a little higher. Is it something I would normally watch? If not for, I think if I weren't yet a doctor, I would definitely watch it. I like that we watched it. I'm happy we watched it. I thought Noah Wyle was amazing.
Yeah.
But I don't know if it would be like one of my shows that I would choose to watch.
Like you wouldn't watch a season 2, you don't think?
No, I would, because I'm curious about it, and I'm sure we're going to dissect it again. Mm-hmm. But especially when I'm the one who helps write it, so which is going to be the case.
Yes. Well, so a lot of them ended up drinking 1 beer on a park bench after this crazy 15-hour shift, or however long it was that they were there. When you had your ER rotation, did you just crash? Did you guys actually hang out?
Never hung out. Would go home and pass out, usually. And I think I told the story, how after one shift, I think when I was on trauma, I still remember I was driving home, and the next thing I knew, someone's knocking on my window. And I roll down the window, and the person goes to me, "Are you okay?" And I'm like, "Why?" Like, "You just rolled into my car." And luckily there was a car in front of me at the traffic light, but had I been the front car in the traffic light, I might've been dead, cause I may have gone into traffic and gotten hit. Luckily there was this car that I just slowly rolled into, and then, wow. Yeah. So
yeah,
I would not have had a beer.
Yeah, I figured. I just thought I'd ask.
Yeah.
All right. Well, so that's The Pitt, all of season 1.
That's our dissection of The Pitt. Very nice. Good dissection, Lauren Taylor. I think you're ready with skills of a surgeon.
I'm ready to know who to listen to if I'm ever an R1.
It was a fun show. They really packed it in. It was a little, I don't know if it needed to be that intense. And I like the charge nurse a lot. She was one of my favorite characters too. The one who got punched in the face.
Yes, that's my feeling about the show. Exactly what you just said.
Yeah. All right, everybody. Thanks for joining us at Gross Anatomy. We hope you enjoyed this episode where Lauren and I dissected The Pitt. Tune in, check us out, stay with us, give us points, comments, questions, suggestions. We love hearing from you.
Listen to stories on TikTok and Instagram.
Hey, everybody. Hope you enjoyed that episode where Lauren and I dissected The Pitt. If you want to hear more, see more, check us on our social media, on Gross Anatomy Podcast, on Instagram, on TikTok, where we do some more dissection and some more gross anatomy.